mental health in the workplace is such a critical issue, one that's overlooked and one that most employers don't even know exists. By the way, we're recording this morning's this portion of the program at least, and we'll be posting it to our YouTube channel a little bit later on this morning, and the folks at Catskill Air and Delhi Telephone and other places will be airing it as well, and certainly in our newsletter. So to talk about some recent programs that are underway, a broad coalition of groups from Otsego, Delaware, Broome, Tioga, Shenango have all gotten together and said this is an issue. It includes the business community, and said we need to respond to this, we need to take some action. So to talk about some of those actions and hopefully give you some actionable items that you can take back to your business today, my pleasure to introduce to you Kylene Jocelyn. Did I get that close?
You did, yeah.
Oh, good, thank goodness. Again, with a last name like Cucci, you're very sensitive to pronunciation of names. Who's going to, from the Leaf Council, who's going to tell us a little bit about what's going on. Here's your spot right here. Thanks.
Good morning, everybody. As he said, I'm from the Leaf Council. That's the Leatherstocking Education on Alcoholism and Addictions Foundation. We serve the Otsego and Shenango County area. Actually, Leaf just celebrated their 40th anniversary, so that was a really cool milestone. I've been with Leaf now for just over a year. They are a prevention and education agency. My background is not in prevention. I have a background in in health administration, and before that, the bulk of my career has been in the legal field as a paralegal. So when I was brought on to the Leaf Council as the project coordinator for team awareness, it was really the administrative role that came to me. And it may sound strange, but how quickly I became emotionally connected with the work that we're doing really took me off guard. And the reason for that is because with this project, we were in the field immediately talking to our community members. And what I came to discover very quickly is really not just how badly the work that we're doing is needed, but how much our community members want it. It was really a powerful experience to talk to people in our communities. In the interviews that we did, they elicited such raw emotion that came totally by surprise to our interviewees. They didn't expect it. It was really, like I said, it was really powerful. We talked to different people from different sectors. They were CEOs of chambers, mental health director, home health agencies. Who else did we talk to? Different people in education. We talked to frontline workers, and there were themes that were developed time and time again, and they all surrounded how absolutely exhausted and burned out and stressed they are. You know, our communities, we are absolutely no strangers to adversity, right? With rural America, our rural communities, we've been facing a lot of issues for years. And when catastrophe hits the nation, our rural communities, we recover, albeit generally much slower than the rest of the country, but we do. And look how long it took us to recover from the recession, 20 years, you know, and we were just getting back to pre-recession statistics when we were lambasted by COVID. And then COVID added a few more challenges for us to tackle. So we have, now if dealing with insane amounts of inflation, supply chain issues they were just talking about, staffing shortages that are worse than ever, and infrastructure and economic pressures to remain sustainable, much less trying to grow our communities. So the pressure is being felt by our community members, and that has absolutely been made clear to us. And the problem is that on top of all of these things, we're dealing with the opioid crisis, right? And if you don't know somebody who has lost their life to an opioid-related death, chances are you know somebody who's been affected by it. And we went into quarantine, not expecting to see the rise and the spike in dependency-related issues that we're seeing, but that is exactly what happened. It was what you did when you went into quarantine. You drink, I've got nothing to do all day now. I don't have a job, and it was all over, social media, and it was a socially acceptable thing to do. You had workplaces. Let's have work happy hour, cocktail hour, bring your drinks, and people came out of quarantine with dependency issues. And the problem with all this is that there's not anything in place for prevention for the adult population. And New York will fund youth education. We can go into schools. We can provide curriculum for them, which is critical. I mean, don't get me wrong, that's absolutely critical, but that's not to say that there's not a need in the adult population. So thankfully, this and all of these challenges that we're talking about has been recognized, and we have been funded to adopt a team awareness model. We are funded by the state opioid response and funding, as well as the Appalachian Regional Commission. They are working with Southern Tier 8 and their economic workforce development, and it's been very interesting because using team awareness from a prevention standpoint and then from an economic development standpoint, it's kind of approaching it from two different angles. The end result is the same, but it's been very interesting, and I've learned so much from that. I'll get into in a minute some really cool stuff that we have been able to get out of the work, our collaboration with Southern Tier 8. But basically what team awareness is it's an approach to mental health, or I should say prevention, kind of through the back door. Because really what we're addressing is mental health of our community members in the workplace. They are burnt out, they're disengaged, they don't show up, they're turnover, absenteeism, just half-hearted work, they don't care. And because they're so tired, they spent half the pandemic doing their job and 3 other people's, probably not even making any more money. Your manager's trying to manage on half of the people, it's a problem, right? And so addressing these issues where people are not tuning out, you're not going on autopilot so that you're adopting all of these unhealthy habits. What do people do when they're on autopilot? I'm gonna scroll through my phone for 3 hours until it's bedtime. I'm not exercising, I'm not doing anything, I don't care. I'm gonna drink for the rest of the night because I can't take the day I had. These are problems that are making our already existing issues in our communities worse. And this is like priming our community members for addiction issues. So by addressing how you cope with these problems, recognizing stress, recognizing what you can do to actively make healthier choices in the workplace, you're reducing all of these negative workplace behaviors. And this has been proven to be an effective approach. So Dr. Joel Bennett, he's the developer. He is based in Texas. He's a nationally recognized wellness expert. He's pretty amazing. Really lucky to be working with him. He has been recognized by the United States Department of Health in having developed this evidence-based model. He's been recognized and awarded by the National Wellness Institute. I think he might be on the board even at this point. But he has delivered this to the National Guard, Amtrak, different national chains. But he's also developed this for our communities, micro businesses. That's the amazing thing about this is that we have gone into the communities and asked our community members, what keeps you up at night? You know, what are you thinking about? What stresses you? What are your workers worrying about? What would make things better for you? And that is what we have built based on those things. So recurring themes kept coming up, and then that's what we addressed in these trainings that were developed out of these conversations. So, what's my next point? We went into these communities, and as I said, we developed these themes. And one of the cool things that we did after we had all of this information is develop a survey that was sent to over 200 people across several counties. They were sent to business owners, and they were sent to like CEO level, like workplace, organization, or high level at the top, so that we could collect certain pieces of information: what the respondents' salary was, how much they spent on on their labor, and the sector, that how many people were in their organization, those types of things. And then we collected the following information. How much time are you spending on addressing work or mental health related exposures? Mental health related exposures being stress, burnout, lack of sleep, fatigue, illness, and alcohol and drug abuse. And what we found out was, it was astonishing. So the average was 38% of the respondents, the respondents spent 38% of their time dealing with those issues. For the workforce, it was 16% of their time weekly. And then he applied econometrics to this, which is, I didn't know that was a thing, it was really cool, but you did that to provide us with a dollar amount. For businesses under 100 employees, on average, the respondents spent $25,000 annually of their administrative time dealing with these issues. For their workforce, it was $108,000. For businesses over 100 people, it was $3.4 million for their workforce and $42,000 annually for their administrative lost productivity. That amounted to, if you took all of those respondents from over the 230 some respondents, for the smaller businesses, it was $9.6 million. And for businesses over 100, $171 million. As if our communities can afford to lose that type of money. So people want metrics to see if this works or how badly this is needed. Dr. Bennett and the work with this team, we're providing that. We're collecting a lot of data with the work that we're doing. So with that information, we have developed 3 different trainings. So the first training is, it's called the Ripple Effect of Wellbeing, and what that really concentrates on is that there really is truly power in the interconnectedness we feel with the people that we live and work with. We have the power to raise the bar for those around us. And when you're making your immediate work area and your department and then your organization, and you're changing the workplace culture, and you have a business that has now got this healthy workplace culture, and you're affecting your community, there is power in that. And it's been done, and that is a really great training for kind of improving that workplace culture. Another one of our trainings is called it's called Resilience to Thriving. And in this training, really what that is about is being very aware of what stresses you out. How do you cope? What is your tendency to cope with these issues? And how can you actively make a better choice? You're not on autopilot. You are aware of what you're doing, and you can make active decisions, right? So the developer likes to say that, bouncing back is really glorified. But who wants to spend their whole life bouncing back? That's kind of exhausting. When you can leverage the power of stress to recognize it as a growth opportunity, you can raise your set point and you can thrive. It's a great training, as my personal favorite, I think. And then we have the Empowered Health Consciousness. And really what that one is about is self-educating on your you know, your prescription medications, not that you shouldn't take them, but ask questions, self-educate. Don't blindly follow, you know, your doctor. You can find alternatives if you want, you know, and if you need to, then just make sure you're educating yourself, really being aware of your personal health and alternatives to that. So we can further adapt these trainings that have already been adapted to our communities to focus specifically on managers and you know, supervisors, or you can gear them towards, you know, frontline staff. We've delivered them in a community setting for not-for-profits. It's really an adaptable training, and we are generating so much interest. It's like almost scary. It's a great problem to have. Like, I don't even know how we're going to keep up really at this point. But you know, I hope, you know, if there's any interest, I'll make sure that you have my contact information. I'll tell you a little bit more about it, whatever you need to know, and we can work on that. So that's pretty much all I have for you today.
Questions?
Yes.
Kylie, Kelly Zimmerman, Superintendent of Schools at Delaware Academy. You had mentioned you were primarily being in Chenango and Otsego counties. These trainings accessible to businesses, school districts in Delaware County?
Oh, absolutely. So as Ray mentioned, we are collaborating with agencies in like 11 different counties. We have agencies, actually ADAC is who brought me here today.
That's the Alcohol and Drug Council
Right.
in Delaware County.
Correct.
Yeah, so
Right.
we're in 11 different counties right now, so, you know,
Right, yeah, I'd be interested in talking with you.
absolutely,
Yeah.
great, I'll make sure you have my information.
Thank you.
And we've offered to the folks at ADAC to hold those programs, if they're in-person programs, over at the Business Center in Delhi. So I'm hoping that sometime over the next, this is really just a sneak preview today. And that we'll be able soon to announce these are the programs that are going to be coming up.
Yes.
So these are live trainings?
Yeah,
And what size group do you usually look for?
So it kind of depends. We are doing trainings. First of all, we can do a hybrid. It's not ideal. Hybrid is not ideal. It's really hard to focus on both, and we have done it. We've learned a lot. We could do it. It's not ideal. We can do it fully remotely, and we can do it in person. So whatever, you know, works for, it's just more important for people to have the message. So we are definitely flexible. Smaller groups of maybe 20 people are generally it's more effective because you can have more conversation. More comes out of it when you have smaller groups, but we've done it with, you know, 40, 50 people in the room. I think we're doing one with 200 people, and that might be remotely. So again, we can be flexible depending on your needs.
Just to follow up on what Carl asked, is it more effective that those 20 people or 25 people are from the same company, or are you targeting a certain level of, you know, are you targeting the execs? Are you targeting the HR people from different companies to attend that program?
Well, it depends on, so generally what we've been doing is if we're organizing events, sometimes, like I said, at one point we were working with the Southern Tier 8 to invite managers and supervisors from different sectors to a training, and we provided them a training. From that, we had members who were like, okay, I want to bring this to my business. So then we contact them, and we just have these interviews with them. What do you need? What do you want? And they might want something specifically for their managers, and then something else for their frontline staff. And that's how we approach it. And it's again, that's the beauty of this is that we're working with, you know, our communities. It's what you need. You know, you're all here because you care about your communities. You know, you wouldn't be here if you didn't. So, you know, that's, you know, I feel so passionately about it because it's important and it's flexible. So,
Andy, you were going to ask?
Yeah, actually I was. How long are these trainings? Are they multi-hour, multi-day? How long are the
So
trainings?
again, even that is adaptable. If you want the full training, And usually an hour and a half is the minimum if you want the training. I would say 2 hours to 3 hours is ideal. That is difficult, we get that, because people have to take their people offline, you know, and that is a challenge. Some people will do lunch and learns. We can pull different modules from the training and fit it in an hour. So, you know, it's really about what works for you.
So it could be spaced out over 2 or 3 days if
Yep.
necessary.
Yep.
Just a comment. I'm Tom Kelly, I'm on the board of ADEC. You mentioned evidence-based trainings, and these clearly are from the statistics you were talking about. I mean, you know, it brings it home as to, you know, how much we're losing. It's such a waste, you know?
This article was actually published in, I had to write it down so I'm forgetting. It was published in the American Journal of Health Promotion, and there were a lot of statistics that came out of that. So if you're interested in the article, let me know and I can send it your way. There was a lot of statistics that came out of that study.
Right.
There's a few questions. I'm wondering how many of these trainings you've done, and when you do go into a company, is it people who are pretty much volunteering to be in it, or are they being sort of told that they should go to this? And then what, could you just give some examples of what you teach them, or
I wish I had my PowerPoints or something with me now, at least to print it out. So the first question is, you know, that's really up to their employer, whether they mandate their employees be there or not. We have talked with some that are like, you know, I can't, you know, I'm not gonna make them, we're gonna hold it. And some are like, oh, you know, we're doing this in this meeting. So it's really up to whoever's implementing it in their workplace. We've started just this summer, so this capacity building took a while, just because this is so new, nothing like this has been done. So it took a year just to get to this point, and we started this summer delivering it, and we have so many scheduled out, like, it's awesome. And the things that we go through in the trainings, there's different exercises that they have you think about, you know, what you would do in certain scenarios, what your reaction is, you know, better alternatives. It's hard to, there's so 3 hours of material, I'm not sure what to pick. But it's depending on which training you go to. There's a lot of dialogue. There's group activities where you just have a discussion at your table. And then, you know, there's flip charts where we talk about what you talked about in your group, and it elicits a lot of discussion. I mean, I haven't been a part of a training yet where the people really aren't engaged in it. I mean, not to say that we wouldn't come across people who are being forced to do it. I don't know. I don't think you should force somebody to be in a training, but
And is it particularly focused on substance abuse, or on generally feeling just too stressed? Or is it
so that is the beauty of this, which personally I think is one of the most things that is really effective about it, is because it really isn't directly about substance abuse. And if you go into a workplace and you're like, drugs, alcohol, people are like, not that they're against the prevention message, but they're like, they tune out, that doesn't apply to me, so, you know, and they don't listen. Or, you know, worker managers and business owners, they're not gonna pull their staff off for things they don't really see as a problem. But they see mental health as a problem, they see stress as a problem, they see turnover, absenteeism, you know, disengagement, they see those as problems because people are not happy. When you have happy, well-adjusted employees, you have productive employees. And so when you address those behaviors, then you're addressing prevention, because they're not gonna turn to drugs and alcohol when they don't need to, when they have life skills to make other choices.
So what would be, like, when you're inviting people to come to it, is it like, are you feeling stressed out? What's the thing that draws them in? What are you offering them? And what do they think they're getting?
Are you talking about the people who set it up that we're working with, or people who actually
People who
attend?
are actually attending.
So basically just, health and wellness is wellness promotion. It is, feeling better and learning how to cope with your stress, and it's really about that, is coping skills and addressing stress and burnout.
I was wondering, like, what kind of fee would it be to attend like a seminar?
We are not charging because we are grant funded. So, until the grant runs out, and that's really special. At some point, these probably will, because, but I don't know, but for right now.
Are you through Oasis or?
Yeah.
Yeah, that's
Yep.
what I thought, okay.
Kelly, you mentioned Shenango and Otsego County, and there's a higher concentration of larger companies in those counties as opposed to what we have. We do have actually folks from some of our larger employers here this morning, but I'm concerned about the ability of smaller business owners to even get away. We have an unemployment rate in Delaware County that's under 4%, 3.9% last month. And one of the things that I'm seeing happening in conversations with chamber folks across the country is attendance at their events, like this breakfast, are all down about 50% nationally. And the reason that members cite is that we can't get away. We don't have the staff to go to a breakfast or go to whatever the case may be, or training during the middle of the day. And this isn't a fair question, but maybe it's a statement. As you're planning those events, please take into consideration, you mentioned that hybrid model doesn't work because the folks on the screen tend to get forgotten to the folks who were sitting at the table. But are there ways that we can better work together to incorporate those smaller, those under 10 employees? In Delaware County, you mentioned, under 100. We have 5 companies in Delaware County that employ more than 100 people, maybe 6. So, we're in our case, we talk about under 10. How do we get to those folks? Because that represents the majority of our employment base around the county.
Absolutely, and we have not forgotten about those businesses at all. As I mentioned, so
That's what he's here for.
we actually developed this what's called a small business needs assessment, and it's specifically for micro businesses. And we absolutely recognize that people, when you already don't have enough employees, and even especially if you're in healthcare, it is nearly impossible to do something like this.
Yeah.
So how we have, gotten around it is using existing, meetings that, they already have slated on their schedule, and they can only have us come in for an hour or half an hour, or as I had mentioned, lunch and learns. And if hybrid is all that works for them, absolutely we'll do our best to make that work.
Yeah, following up on what Ray just said, so I'm not representing a business, I'm representing the Rotary Club in Hobart, New York. And as you were talking, I was thinking, it would be really interesting to have you come and talk to Rotary. But that would be, in my mind, that's the way, because I keep thinking about my little town, my little village, and I don't know the people in my village who are having the problems that you're talking about, and I'd like to understand that better. And so using like a lot of almost every town around here has a Rotary Club, and that would be a type of venue where maybe you could come talk about these issues, and Rotaries could organize wellness sessions, like, you know, on a weekend or in the evening or something like that, you know, using this, but that might enable people from small companies to attend.
Yeah, I mean, if you want to connect with about that,
Yeah.
that's really an interesting approach. And, you know, we're willing to explore anything. I mean, we're here to serve our communities and, you know, explore all options, and, you know, it's important. So definitely we'll connect.
Yeah. Do you have, if someone does a 3-hour maximum kind of sort of training, I see that as a good introduction, but do you have things that you can leave behind or ways for people to set up workshops within their own company so that they can continue that?
That is interesting that you mentioned that, because we actually do are developing that as a part of Team Awareness. It's called the Ambassador Program, and that really teaches people who want to volunteer, who want to, you know, address that within their workplace, and also an advocate training for people who want to be advocates in their communities or in their workplace. We are absolutely developing this to be sustainable beyond this grant, beyond being directly connected with a developer who is, you know, has done a lot of hand-holding so far, but are developing the capacity to continue it. And that really is one of the most important parts of it, is to keep it sustainable within their business, you know, so that is a part of it as well.
So a train-the-trainer type of concept is something.
Yes, and we are developing an advocate training now. That's like in the process. We are developing that.
I think that's so crucial, because you can't just jump into something like this without a support system to help you after, you know, I mean, to continue it, implementing it.
That is very true, and it's something that is very important to the developer. That was absolutely key for him that we address that.
And once again, not just in the company, but in the community. So because I think that a lot of people who are in these situations of being really depressed or having problems of whatever kind, they isolate, you know, and so you don't know. And so if there was some kind of a mechanism where people knew they could safely reach out, it would be really great. And especially, and it's difficult, you know, we don't have a mental health facility, you know, where we live. So if there is a way for people to offer that support without having to be mental health professionals themselves.
You know, I don't know if I said this or not, I can't know, but, you know, a lot of this also is about teaching our community members and your workforce to know how to access resources and to reduce the stigma enough to support one another, to, you know, tap into how many businesses, maybe not, you know, micro businesses around here, but how many businesses have EAPs and their employees it's not utilized. They're like EAP, like I think I heard about that 7 years ago when I was on board, and I don't know. And even if they do know about it, they're not likely to tap into it because there's like a stigma attached to it. So there are resources within our communities, and, you know, having somebody that knows about that, like that's, you know, ambassador, advocate information that, hey, you know, I notice that you're not doing well, and just having those conversations, that's part of building that culture.
Other questions, comments? Eileen's going to be with us after the program to make those connections and answer some other questions and the like. So thank you so much.